Aloha, everyone. Thank you for the gift of your time in joining us today. In just a few moments, Governor Josh Green will sign a bill to implement a medical debt acquisition and forgiveness program. Facilitated questions and answers with the media will follow promptly after remarks conclude, and the formal bill signing will commence shortly thereafter. Now it is my privilege to introduce to you Governor Josh Green.
Aloha. Good to see you. Aloha. Today we're going to talk about medical debt, and the legislature has done something extraordinary. They have stepped in with an initiative that is kind of spreading nationally a little bit to help people who have come to a place, and it's very common, where they've accumulated medical debt and it's affecting their lives. They may have not been in a space where they could work after being hurt or sick, and they've accumulated this debt and it hangs over them. I want to talk very briefly before I get into my formal comments about just where we are in general as a state. Things are very expensive. Affordability is, from what I'm hearing from everyone, really our number one issue. Being able to afford to live here, stay here. So there are several things that touch that. There's the cost of housing, which is extraordinary, and that's why we're doing all that we can to build more housing. It takes time. Then there's energy costs, and we debate back and forth. Just we need to do something solid to decrease energy costs again for cost of living purposes so that people can live here, so our families can have nurses that live here, or firefighters, teachers, everybody, have our kids here. It's very important. But then there's at least another big variable, and that's medical costs and medical debt. So I'm going to dive into this bill now. This is a bill which is Senate Bill 3025. You're going to hear from our champions here in a moment. Senator Kehokulole, who's been a superstar on health care, has been really an innovator these last couple of years on major consumer protection matters, and this is one of them. So thank you, brother. Lisa Martin, same way. I see you all the time on these issues where we're fighting for people and just where they're struggling. And these are our health leaders, and we're joined with a bunch of other just real visionary legislators. It's important because they're taking up the right struggle, which is making sure people can get on with their lives and survive here and just have a positive existence. So medical debt. Unfortunately, about 1 out of 20 of our adults in this state have some kind of medical debt on their record. Maybe they didn't have a primary care physician, ended up in the ER seeing, someone like me, and it's very expensive. Bill $4,000 or $5,000 or $6,000 for even basic care, as Lisa and I were talking about. Yes, hospitals are expensive to run, but none of us have $6,000 to conveniently come out of pocket. Even after the insurance that we very likely have has been applied, we might still have $800 or $1,200, and very few of our citizens just have that much extra money around. And before you know it, you're paying for housing and for food, for education, and then you might get to that medical bill. And if it continues to persist, it can crush you. Then it's a higher percentage. Then your credit rating drops. And, it's a big problem because not only do you have that hanging over you, then people are reluctant to go to the doctor for primary care, for basic care. And that's what you see on that slide. That second point is very important. Medical debt can delay the needed care that people get. People don't go back to work in time. They don't get the rehab that they may need. And then the next thing you know, they're not as employable. And it becomes a very unfortunate self-perpetuating destiny, which is you are having a harder and harder time paying your bills. Things stack up. It adds stress. People have depression. These are realities for so many of our people. But enter this excellent piece of legislation. This bill, again, Senate Bill 3025, authored by Senator Lee, who's just, been a stud on so many things in energy. And yesterday we passed a bill about colonoscopies. Yes. Poop, yes. So we've gone from, rectal exams and colonoscopies. And, that was actually environmental protection and cesspools. There's so much poop in the air right now between colonoscopies and cesspools that I don't even know what to say. Sorry. It's signing a lot of bills right now. He was involved in all of them. It's special to see this because what this bill does establishes a medical debt acquisition program forgiving debt. It's not for it's not going to be for everybody. I mean, I want to say very openly, if you can pay your medical bills, you must. You have to go do that. But for those where these bills have been accumulating and then they get sent to collection, the legislature has decided it's the right thing to do, and I totally agree to step in. We happen to have TIA's team, which is just amazing, at the Office of Wellness and Resilience. It was created by Senator Dela Cruz and team. It's been funded. They've been growing their staff. These guys really work on decreasing people's stresses and helping people become more resilient in society. That's why I think this landed in OWR. So the medical debt acquisition team is going to be there. Let's go to the next slide. What they will do is they will develop a streamlined process to administer this program. They're very nimble. They get these things done. They were there on the ground when we had the Maui wildfire. They are there to assess what our stress levels are as a state. They've been doing great work. So we decided to add something more to their plate, which is to help people reduce their stresses. And what has happened is this accumulated debt for as many as 50,000 of our residents is there. The legislature found a way through this program, and you're going to hear from this excellent guy named Matt. Josh Wish tells me he is a star, and so we'll see, though, in a minute. Matt and Josh and their company came up with this proposal and worked through the legislature so that up to $91 million of medical debt for the people of Hawaii will be forgiven. And we bought this at $500,000. So like less than a penny on the dollar, well less than a penny on the dollar, we are able to help people. And I think people are going to need a little help. Also, we're going to enter into an era where, unfortunately, there's going to be a lot of pressure, downward pressure on Medicaid. We have had about 400,000 people on Medicaid, plus or minus, perpetually out of our 1.4 million people. So 2 out of 7 people are on Medicaid. And if their bills get high, even if it's mostly covered, there are going to be copays, there are going to be other challenges. They could end up in serious debt. They already are challenged economically. If we see more of that from the federal government, we're going to need more of this support for people. And that's really where we're coming from. So overall, it's meant to just make sure that if you're really hurting out there and you have a lot of medical debt on your record, we're gonna fix that. And the team under T is really going to get this revved up this year. I think that might be my last comment. Let's see one more slide. That's just me. I spent a lot of years in the emergency department seeing people, and many, many times people ask me, do I really have to have that test? Because I know it's going to be expensive. Do I have to have a CAT scan of the head after a car accident? I know it's going to be thousands of dollars. And I worried that they might have a bleed, but I understood what they were saying, that the risk of having a bleed versus not being able to pay for their child's preschool, that was like a real question. That kind of example came up over and over again. So we're not going to do that to people anymore. But if you ended up in that circumstance, let us try to help. Aloha.
Mahalo, Governor. Next, I would like to introduce Senator Jarrett Keohokalole, Chair of the Senate Committee on Commerce and Consumer Protection.
Hi, aloha, everyone. 2 quick stories. During COVID, when the misinformation was running rampant and the yahoos were protesting outside of the governor's condo, I had a conversation with a couple of people who were struggling to understand why we were taking the pandemic so seriously here. And they pointed to how the surge we were dealing with at the time was also going on in a different part of the country, a more rural state. And I explained to them how there were these stories popping up all over the country where when a hospital was overrun during COVID, the families would just drive across state lines until they could find a community where there wasn't a surge, and they'd take grandma to the emergency room there. And how we could not expect communities in Hawaii to put grandma or grandpa sick with COVID and in a community where the hospital was full on an airplane to go fly them to Los Angeles to drive around till they could find an open bed. And that's the perspective that we think of here in Hawaii that everyone in the room can understand immediately, and some people need a reminder. This is the same concept. As the governor talks about all the time, we take care of people here. Why? Because that's what we do. That's the culture here. And when you have someone who has medical debt hanging over their head and they're reluctant to go into the doctor, that doesn't necessarily just affect them. It affects everyone in the family. If it's the head of household and they're the ones that have to drive grandma to the hospital and there's that hesitancy, then it just creates a cloud over the whole family. And all of us suffer as a community when people aren't getting access to care. We have great metrics. We score high as a state on healthcare metrics all over the place. But if families aren't getting access, then it doesn't matter to them. And that's what this bill is about. Chris Lee is the driving force on this. He just has done too many of these this week, so they're letting me talk on the mic. Thank you, Governor, for that. And thanks, Chris, for not tripping me on the way over. It's a big deal. Pennies on the dollar. This is a very good expenditure in the community's interest. Second story, my daughter last year, at the beginning of the year, 12 years old, in the 12U soccer tournament playing goalie, she took a low liner and it hit her in the pinky and she shattered it. And it was $1,700 to put the splint in place before the cast. I was thinking about arguing with the doctor about how many different things we had to do to fix her pinky, because she's a kid, and those things mostly put themselves back together, but it was $1,700. And if we didn't have insurance and if we weren't well situated to be able to pay that down, we'd have been in the same situation. And that's not an expenditure that families across the state can bear and just eat. And that's the type of, it's a little minimal soccer emergency that happened, and everybody can imagine some sort of little incident or accident. Things happen where you could find yourself in that situation, and we can't afford community to be under that sort of stress and uncertainty in the moment we're in now, especially. So it's a relatively small expenditure for a tremendous impact. So to Josh and Holomua and Chris and Chair Martin and Tia and everybody in the room who's a part of this, thank you so much for your work and making it. This is going to help people in a real meaningful way. It's a great bill. So happy to be a part of it. Thank you.
Mahalo, Senator Ke'ohokalole. Now please welcome Representative Lisa Martin, Chair of the House Committee on Human Services and Homelessness.
Aloha. So it should never be a reason, fear of medical debt should never be a reason for people to delay care or not seek care that they need. We know how that becomes more expensive over time, right, when we don't treat things early. And for people that have gotten care and they're in medical debt now, what we're seeing is that the healthcare providers will try to go after that payment, and they will contract out to third parties, but at some point they give up. And when they give up, that debt isn't gone. It's still hanging over the head of patients, and it's still affecting their credit score, possibly pushing them towards bankruptcy. It's also causing a lot of depression and anxiety. So for a bargain, and we all love a sale and a bargain, we're able to erase this medical debt, which the providers are not going to get anyways, most likely, and take away that stress, improve people's credit scores so that they can, be stable in their housing and in their businesses. So anyways, this is an amazing opportunity. This is not something that people can go and apply for. If people are thinking, great, I'm going to apply now. This is something that healthcare providers look to see who is eligible, and there's income requirements. It's about percentage of the debt versus your income. For those who are eligible, they'll just get a notice, kind of like Christmas, that their debt was forgiven. And hopefully this will be the first of an ongoing program, right? These funds will be spent down very quickly. But hopefully once the Office of Wellness and Resilience, who so graciously agreed to run this program with no extra staff, once we have that established, hopefully it will be a conduit for many future tranches. So I really appreciate the authors and the nonprofit organizations that have been doing this work and pushing for this work over time. And so happy that it's happening here in our state. Mahalo.
Mahalo, Representative Martin. Up next, please welcome Matt Prellberg, Policy and Communications Director from Holomua Collaborative.
Aloha mai kako. My name is Matt Prellberg. I am the Policy and Communications Director at Holomua Collaborative, a local nonprofit founded to advocate for policies that affect affordability and economic opportunity to make sure that our local working families can afford to stay here. About 7 years ago this month, my niece left the NICU at Kapiolani Hospital after being there for the first 10 months of her life. She was born with a condition that ultimately caused her to have multiple life-saving procedures within her first 10 months and have constant nursing care for about the first 2 years of her life. My brother calculated the costs, and he found that within those 10 months, they would have racked up approximately $2 million worth of medical bills. They didn't get a menu to choose what it was going to be and choose which procedures to use. They kept their daughter alive. That was the choice. They needed to make sure that their daughter was alive and the cost didn't matter. But in this case, they were blessed to have wonderful health insurance that was able to cover the majority of the cost, and other social services that currently exist were able to help them as well. But the reality is that and this situation is not a situation that is common for too many families in Hawaii. Medical debt is fundamentally different from any other type of debt. It's not a car loan where you negotiate your interest and your price. It's not credit card debt where you're spending on a nice outfit or a nice dinner. You don't choose to get sick. You don't choose to get injured. You don't choose to have a medical emergency strike. And often when you are, as mentioned, you don't know what the costs are going to be up front. You just pay the bill as it needs to happen. And as some families in our state that do not have health insurance, they often have to choose between, are they getting health care or are they paying their rent? Or are they even going to make sure that their family can stay alive? As mentioned, this bill will forgive $91 million of medical debt for pennies on the dollar. It helps replace a predatory debt collection market with real life-altering compassion and hope for an economic future for our local working families. Want to strongly mahalo Governor Green for signing this wonderful bill, Senator Lee for introducing and championing it for the past 3 years, the Senate and House chairs and the other members that worked so hard, Representative Martin, Representative Senator Keo Hokolole, Senator San Buenaventura, really pushed because they understood the importance of this bill and what it's going to mean for the local families in Hawaii. And then lastly, need to majorly mahalo TIA and the Office of Wellness and Resilience. Their advocacy, their efforts, the studies that they've put through their wellness survey that they do each year, really provide some of the data necessary to know that this bill is going to make a difference. And without their willingness to take this on, I don't think it would have happened. So mahalo for all of your hard work. Today, we aren't just erasing debt. We are preserving our communities and making it possible for Hawaii's family to keep their roots firmly planted here. And we look forward to seeing more efforts like this in the future. Mahalo.
We have actually, the question that the media had has been answered kind of repeatedly. So at this time, I would like to call lawmakers and key stakeholders to join Governor behind the desk for the bill signing.
So just a reminder to people who may have not caught it up front, there's as much as $91 million in potential debt forgiveness that's going to occur for just $500,000 because these thoughtful leaders were able to really work the problem. And that means a lot less stress for people as they move on with their lives after going through what was likely a very difficult time where they sought health care, received health care, but it simply was too difficult at the time for them to repay that debt. So we will be handling this through our Office of Wellness and Resiliency, and I really just want to reinforce the idea that we want people to be able to afford their lives in Hawaii. So you'll keep seeing work on housing. The legislature delivered on tax breaks like you never saw before. And now you can see us working on problems on the other side where people are carrying this large debt and it's just very tough. So thank you guys for this. It was really wonderful. There you go, buddy, for you. Thanks, we wrote that bill. That's all there is, really. So,
Mahalo, everyone. This formally concludes our program.
Yeah, but we're going to do some additional pictures if people